Fellow vets, if you hurt your back in service and don't have in-service medical records, don't give up. Today I'll show you the clean, legal path many vets use to build a strong back claim and how secondaries can add up to a 100% combined rating for some veterans. Quick note, this is education, not legal or medical advice. Every claim is unique and there are no guarantees. First mission, service connection. No records from back then? You can still win. File a personal statement on VA form to 14138. Put your story on paper: MOS duties, ruck marches, heavy equipment jumps, PD injuries, airborne ops, whatever actually happened. Explain the wear and tear or the specific incident in plain English. Don't rely on a CNP examiner to capture your full story, you put it in the file. Next, get a current diagnosis. If you didn't go while in, go now. You need a present condition documented. Back pain, lumbosacral strain, degenerative disc disease, herniated disc, whatever applies. This starts your paper trail. Then, the bridge, a nexus letter from a qualified clinician. It should say it is at least as likely as not your back condition is due to service or secondary to something already service-connected, like a knee injury that changed your gait. If your own doctor is willing to review and sign a drafted template, great. If not, there are independent options, but weigh the cost versus the benefit. Once connected, how is the back rated? Under 38C, F, R. For the spine, the big factor is range of motion, especially forward flexion, measured with a goniometer during the CNP. Forward flexion of 30 degrees or less typically lands around 40%. Be honest at the exam. Don't push past pain trying to tough it out. The goal is an accurate picture of your functional loss, not a fitness test. Many back issues have radiculopathy or sciatica, that numbness, tingling, or shooting pain down one or both legs. If diagnosed and documented, each leg is rated separately. Mild can be 10% per leg, moderate 20%, and moderately severe 40% per leg. Having it in both legs can also trigger the bilateral factor, which bumps up the combined math. Chronic back pain often affects mental health, anxiety about flare-ups, loss of activities you loved, poor sleep. If clinically diagnosed and linked, conditions like depression, anxiety, or somatic symptom disorder can be claimed secondary to the back. Many vets are surprised how much this matters in the combined rating. When you stack a properly rated back, bilateral leg radiculopathy, and a secondary mental health rating, the combined rating can reach 100% for some vets. It's not magic, it's documentation, nexus, and accurate rating criteria. Again, no guarantees, just a roadmap many have used. On exam day, confirm the examiner uses a goniometer. Demonstrate your actual limitation. Stop at the first sign of pain. Describe your flare-ups, functional loss with repeated use, and how daily life is affected. You're not there to impress anyone, you're there to reflect reality. So here's a quick checklist. Get your VA form to 14138 with a clear service story. Get a current diagnosis and continue your care. Get that nexus letter linking it to service or a secondary condition. Don't forget radiculopathy in each leg and the bilateral factor. Consider secondary mental health if it's diagnosed and linked. And at the CNP, be honest about first pain and functional loss. I'm the VA Claim Compass. If this helped, like, share, and subscribe. Drop your questions in the comments. I'll keep breaking this down so you can file smarter and protect your benefits.